My name is Keiji Shirai, Safety Advisor. This lecture will focus on emergency bandages. Emergency bandages are sometimes called Israeli bandages because of the country in which they were invented. The main purpose of this training course is practical training. This is because you will not be able to acquire subtle know-how without attending the course and actually applying the emergency bandage. First, we'll discuss basic knowledge of blood. The primary role of blood is to carry oxygen and nutrients to the various organs of the body. The human body carries about 8% of its body weight in blood. If half of that is lost, death occurs. Therefore, even if there is no sudden massive hemorrhage from the aorta, prolonged bleeding will result in death. Please understand from this list why massive bleeding causes death. The purpose of hemostasis is to prevent bleeding to death. In many cases, treatment by a physician is necessary, and emergency bandages serve as a connecting link. Hemostasis with an emergency bandage is a method of direct compression hemostasis. Emergency bandages are used in cases other than massive aortic bleeding. Bleeding from common injuries can usually be stopped with an emergency bandage. Emergency bandages were invented in Israel, and their effectiveness was recognized by the U.S. military, which officially adopted them in 2002. The container and body of an emergency bandage. There are wide and narrow ones, but we recommend the wider one due to its wider application. The bandage is vacuum packed for convenient transportation, clean use, and long-term storage. The construction is simple, consisting of an elastic bandage with a sterile pad, pressure bar, and a hook bar for fixation. The emergency bandage applies stable and strong pressure to the bleeding area to effectively stop bleeding. Emergency bandages can be used over a wide area of the body. Training is required to quickly and correctly apply the emergency bandage to stop bleeding. First of all, it is important to always carry an emergency bandage and have it ready for immediate access. When using an emergency bandage on someone else, inform them that you have received training and ask for their permission. Always put on polygraphs in advance to prevent infection. Adjust the position so that the wound is centered on the sterile pad. The most important thing is to apply strong tension to the emergency bandage in order to stop bleeding. It is important to practice on a specific injury site. With repeated practice, it will be possible to stop bleeding from unexpected sites. Try emergency bandaging for bleeding from various sites. Practice applying emergency bandages to help bleeding person to stop your own bleeding and in the dark. Here is an example of training to apply an emergency bandage to your arm. First, place your arm through the tubular end of the emergency bandage. This will allow you to pull the bandage tighter with your uninjured hand. Adjust the sterile pad so that the wound touches the center of the pad. Place the emergency bandage over the plastic compression bar. Pull the emergency bandage strongly to the opposite side and wrap it around the compression bar so that it falls over. Circle the emergency bandage over the compression bar while applying strong tension to the bandage. Wrap the entire compression bar with the emergency bandage under tension. For even stronger tension, twist the emergency bandage as it is applied to the compression bar. Finally, the hook bar at the end of the emergency bandage is placed over the wrapped emergency bandage to hold it in place. If bleeding is difficult to stop, insert the hook bar into the last roll of the emergency bandage. Rotate it, apply strong tension, and apply more pressure. Emergency bandage can stop bleeding from many parts of the body. This is to stop bleeding in a wound near the knee joint. An emergency bandage can also stop bleeding from a wound behind the shoulder. An emergency bandage can stop bleeding from a stab wound in the abdomen. Bleeding from a forehead wound can be stopped with an emergency bandage. Bleeding from a neck wound can be stopped with an emergency bandage. Depending on the site of bleeding, the use of an emergency bandage may require some expertise. Please learn practically in the workshop. Once you learn how to use an emergency bandage, it will be useful throughout your life to stop bleeding in the unlikely event of an injury to your family or yourself. However, training is always required to be able to use an emergency bandage quickly and properly. Thank you for watching.